Hello everyone, my name is Sarah Tornamy. I am a clinical specialist physio on the M15 team in the Midlands Regional Hospital in Mullingar. I just want to give a little disclaimer. I only started in the post 3 weeks ago, so I felt it was important to mention that point. Just to give you a bit of background, I've worked specifically in older persons care for the last 10 years plus. The role that I just came from, I was the senior physiotherapist on the integrated care team for older persons in Dublin Northwest, Connelly Hospital in CH09. So that's kind of my most recent background. But I've worked in older persons care across all settings. So in the acute setting, in the rehab setting, day hospital, and in the community as well. So I've kind of been exposed to older person care throughout the patient pathway or journey. So I think hopefully I will do this presentation justice and do the team justice, but as I said, I am quite new to the role, so go easy on me. Question? Okay, so let's get started. So just to give you a quick overview of the team, so we're an integrated service for the frail older population in Longford and Westmeath. So our current staffing, we have a 1 full-time equivalent clinical specialist physio, myself, we have a senior occupational therapist, 0.5 senior SLT, 0.5 dietitian, and 0.5 senior physio as well. So that's the making of the team at the moment, and there's a lovely little picture of the team there. So our primary target group, or our beneficiaries, are those people who are over 75, who are screened and deemed positive for frailty. And of course, their families and their carers are also going to benefit from this service. So MFIT provides a rapid, holistic MDT assessment and intervention, so that's really, really important. The CGA, yes, it's a comprehensive geriatric assessment, but we also provide intervention in the ED setting. So that's I'll talk a little bit more about that later, but that is a key message to get across today. It's not just assessment, we provide the therapy intervention in ED with the hope that we can turn that person around and get them home. So we're able to identify the needs of the patient from the first contact with them, and we provide interventions in a timely manner, which reduces the risk of hospital admission, as I said, and if admitted, we also reduce the risk of adverse effects, which is really important. We are the only team in Longford and Westmeath that provide this specific kind of frailty for older persons ED-based service. We provide an advisory service also for HSE estates, where we're planning hospital refurbishments, which is happening in Mullingar at the moment. We are involved in the dementia and delirium working group in the hospital, and we advise around how to set up dementia-friendly environments in acute hospital settings. So we're in the early stages of that, and we're trying to roll out, we're starting with one ward in particular, and we're trying to roll out a dementia-friendly environment, so changing the complete look of the ward to make it dementia-friendly. And we hope then that will continue throughout the hospital. Obviously COVID has just stopped that in its tracks a little bit. So that's a really, really important part, that although we're on the ground, we're providing this clinical service, we also do work as an advisory kind of service as well to appropriate groups. Okay, so progress and outcomes. So 144 less frail older people are being admitted to the hospital following an emergency presentation in 2021 compared to 2018 pre the M15. If admitted to hospital from home, older people are more likely to be discharged back to their own home, and that is essentially what we are striving for. This in turn reduces the number of older people being discharged to nursing home, convalescence, long-term care settings following acute hospital admission. So again, what Des was speaking about earlier, supporting these people to stay at home. It is resource heavy, but I mean, it's putting the person at the center, okay? So I always think of that message, nothing about me without me, okay? So we are trying to engage the older person, the service user, in the plans, in service delivery as well. So I think that's a really good message, nothing about me without me. So to go back to the outcomes again, my final point, the 7-day readmission rate to ED has reduced from 7.27% in 2018, so that was our stats in 2018 pre-MFIT, and there's been an overall reduction that has gone down to 6%, so an overall reduction of 15%, so I think that's a really, really positive outcome as a result of our team. Okay, so again, when I'm talking about nothing about me without me, we're trying to engage the service user and actually get feedback from them in terms of how we can progress and expand and develop our team going forward. So just a few little comments there that you'll see from the service user, but also from staff that have benefited from our team being in place. So for example, Mary, who is 94, she just said, I really enjoyed talking to you. So sometimes in a really busy ED setting, you know, unfortunately time constraints and that, you know, you're not all the time getting a holistic picture of really what's going on with that person. So actually for them to have an opportunity to give their story to someone, I think is really, really important to them in that busy setting. Also an example of a testimonial from a clinical nurse manager on the ward. She said it makes it so much easier for us when you MFIT have done a CTA. So the importance of how that impacts on the staff across the hospital setting, and also the community setting. So a community OT was saying it's great that frail patients are getting that intense rapid response. So that's what we aim to achieve. And then lastly, I suppose from a family member's perspective, this is the first time someone has looked at the full picture, taking everything into account. So I think that really says it all there. Okay, so again, looking at putting the person in the centre, and the person is the focus, and our person-centred care. One question in all of our comprehensive geriatric assessments that we ask everybody we see is, what matters to you? And actually sometimes they're taken back by that question if they don't get asked that very often, maybe in a healthcare setting. So, you know, often they kind of say, oh, I've never been asked that before, but actually it's probably one of the most important questions that we need to be asking, in terms of making sure that that person is at the centre of their decision making, and that we are taking their wishes into consideration in terms of advanced care planning. And, you know, what planning for the future, what does that look like for them? You know, what does that mean for them? So nothing about me without me is another one that I like to use a lot. So that person has to be at the centre of decision making, and that's an area that we're trying to develop on the MFIT team as well in terms of advanced care planning, and I'll talk a little bit more about that. So that document I really recommend. It was, it's the National Integrated Programme for Older Persons have released this document on what matters to you, so it's a really valuable resource. This slide was supposed to say challenges, and I did realise this morning when we were listening to other challenges from other speakers, then there should be 2 challenges in there, and the ones that I had included were just, unfortunately at the moment we are, there's staffing vacancies on the team, which is so a challenge for everyone across the board. So you know, in the next couple of weeks we hope to have more staff on board, but at the moment we're at 3.5 WTE team, just down to 1.5 at the moment, but we're just hoping, and there are plans in place for recruitment to happen in the immediate term, so looking forward to that. The other challenge that I had mentioned is just around enabling equipment. So obviously, if at all possible, if we assess someone in ED and we feel that, you know, this person could go home and be a lot safer at home and be able to stay at home with simple, you know, pieces of enabling equipment to allow them to function better at home, that is important that we have that at our disposal, but it is a national problem at the moment. I forgot to mention, so I worked on an integrated care team in Dublin Northwest in CHO9 for the last 3 years, and I mean I'm seeing it across. It's been a huge issue in recent months on the team that I used to be on, and it's just supply of equipment. So it's not that the finance isn't there, the money is there to pay for this equipment, but unfortunately due to Brexit is one issue, and that big issue on the Suez Canal, would you believe, it has hugely impacted on the supply of equipment available to us, and that is a nationwide problem at the moment. So it's just worth mentioning, I think. Okay, so what's next? What are our plans for the future? I think anyone who's worked in older persons is familiar with this slide. So it really is looking at expansion of the service and how we expand our current existing older person service. So you'll see there, as Des spoke about, our specialist ambulatory care hubs. So the next step for us really is that the integrated care team comes into place, and that actually there are direct pathways set up between the Frazee and the front door team, which you'll see here, and our integrated care hub, and that's going to give, you know, there's going to be obviously direct pathways, but both teams are very, very much going to help each other in terms of being able to keep someone at home for longer, avoid ED, hospital admission, ED avoidance. All of those are our key outcomes, but actually with those teams working together, that's going to be much more achievable. So we're looking forward to that in the future. And yeah, any questions I'm happy to try to answer.